If you have osteoarthritis or OA of the hip or knee, you're not alone. In fact, 1 in 2 adults will develop symptoms of knee OA, and 1 in 4 will develop symptoms of hip OA in their lifetime. OA may get worse over time and cause you to be less active than you're used to. While moving may feel painful, exercise can actually help. To understand why, let's see what happens in OA of the knee. Your knee is made up of 3 bones: the lower end of the thigh bone, the upper end of the shin bone, and the kneecap, and 2 types of cartilage, one to protect and cushion the bones when you bend and straighten your knee, and the meniscus to absorb the shock between your thigh bone and shin bone. When you have OA, the cartilage or cushion in your knee wears away over time, so the bones rub together, causing stiffness and pain. Many people try to relieve their pain by resting, but continued avoidance of activity due to the fear of the pain coming back can do more harm than good. Over time, lack of activity or exercise leads to weakening of the leg muscles, causing the knee to become more unstable or wobbly, and making it harder to perform activities and avoid further injury. If this cycle sounds familiar, it's important to know that avoiding activity altogether can actually increase your chances of becoming more disabled by your knee OA over time. You have the power to stop the cycle if you just keep moving. Exercise can strengthen the muscles around OA-affected joints to help stabilize and support your knee or hip. In fact, moderate physical activity, at least 3 times a week, can significantly reduce the risk of disability in some people with osteoarthritis. And the benefits don't end there. Physical activity can help manage or reduce your weight and lower your risk of heart disease. Get started today. Visit Tylenol.com/exercise to find easy-to-follow videos brought to you by the Keep Moving program from the makers of Tylenol 8-Hour Arthritis Pain. Before starting or changing an exercise program, talk with your healthcare provider.